Hello, my name is Dr. Saif, and today I am going to speak about the monitoring of respiratory rate. So, how do we monitor the respiration in ICU? That's the topic today. ICU or emergency department. Okay, so we can monitor either by looking at it, that is observation, or we can say that is a manual method. And another way of monitoring is machine, that we are using something automated, that without looking at the patient we can monitor the patient, the machine or automated. In manual, as I said, we have to observe the respiratory movement, okay, with each cycle of respiration. So respiration movements or respiratory movement need to be observed in manual. Or what we can do is that we can auscultate also, that is observation means inspection. And another way is that we put a stethoscope and auscultate over the chest. So we auscultate over here, we auscultate over here, we can auscultate over here, or at the bases here, at 6 places, and even on the back also we can auscultate and count the respiratory rate. Okay, that is breaths. The unit of RR is breaths per minute. Normal is 12 to 16 is normal. And when respiratory rate becomes more than 25 or in some cases more than 30, then we call it as tachypnea. That is abnormal high respiratory rate. And this respiratory rate is very, very important. Sometimes RR more than 22 is also one of the sign of sepsis. Okay, so as we know that what is QSOFA. In QSOFA there is three things: S, A, T. S means systolic blood pressure less than or equal to 90. A means altered sensorium, and a T is very important, that is related to respiratory rate, tachypnea, that is RR more than 22. So that is your QSOFA. If QSOFA is more than 2, then there is a high possibility that patient may have sepsis. Though nowadays QSOFA is not much used to detect sepsis according to 2021 guideline. Okay, now, so as I said, we can do it manually. Now, what about machine? So we have monitors in ICU. Those monitors are called multi-para monitor, in which there is a respiratory module. Okay, and and it captures the current between two ECG leads. Okay, so there is a red lead on the right side of the chest and green lead, okay, on the left side of the chest, and current flows in between. And if the current is impeded by the respiratory movement during inspiration, so that is captured by the electrode, which will be counted as one breath. And this technique is known as impedance pneumography. So this is the technique by which ECG can give you the RR, respiratory rate. Okay, so which ECG lead? Only the right lead and left lead. R for red and L green. So this will be green lead, left side near the heart, and this will be the red lead. Okay, so ECG lead used to detect the respiratory rate. That is one way, and the technique is called impedance pneumography. Right, impedance pneumography, that will give you the respiratory rate on the monitor. Another technique to automatically monitor the respiratory rate in ICU is EtCO2, end-tidal carbon dioxide monitoring, or otherwise known as capnography. Okay, so this is number 2 technique. Number 1 technique is impedance pneumography. Number 2 technique is EtCO2, where the EtCO2 monitor will capture the airway respiratory rate, that is AWRR. Okay, now the third technique is the ventilator technique. If the patient is on ventilator, okay, the ventilator will detect how much breath patient is able to take. So that is due to flow sensors. The flow sensors are there on ventilator, so that will sense how much patient is taking the breath. Okay, so that is also one more way to detect the respiratory rate or monitor the respiratory rate in ICU or emergency room. So we have discussed so far that there are 2 techniques of monitoring of respiratory rate: manual and machine. Machine means automated. Okay, manual we can do by 2 ways, A or B, that is observation, that is inspection, or B, auscultation, using the stethoscope and count the respiratory rate. And second way is machine. Machine can be of 3 types, 3 techniques: impedance pneumography, which is most common way of monitoring the respiratory rate on multi-para monitor, which are available in all ICUs. The second technique of automated RR monitoring is EtCO2, and that will give you airway respiratory rate. And the third way is the ventilator, which will be able to monitor the respiratory rate using the flow sensor. So these 3 techniques of machine or automated way we have discussed. Thank you so much for your attention.